Law enforcement agencies and health authorities are pleading with South Africans to behave as they cross over to 2024. And for those in need of emergency services, officials in Gauteng Health MEC promise to be on standby to respond speedily. For more on this conversation, we're joined by Newzroom Afrika's Ngobile Madlala, who's joined by emergency services officials. Ngobile, during this time of the year, emergency services personnel usually have their hands full. What's the situation where you are right now?
Well, I can tell you, Nkatla, that there's quite numerous calls that we saw the MEC already responding to. Already the command center was just going wild with a number of calls, people calling in. So we are going to find out more about those calls. But I want to show you behind me, these are some of the vehicles that are going to be responding on the ground. We understand at this very point that we have had over 350 ambulances that are currently active in Gauteng and all around. I want to bring in now the MEC to speak to us about this. MEC, how many calls have you already answered to?
I've already answered about 5 calls, but 2 from Ekurhuleni and the other 3 were in Tshwane in Mamelodi.
And so far, how many calls have the command center received?
They've received over 1,500 calls already, but they're still coming. As you can see, they're buzzing in all the regions. Quite a number of people that are phoning now, and some of those calls are trauma cases, because I'm sure you'll want to know what is it that people are calling for. It's trauma cases, it's suicide and gunshots.
It's quite concerning because this is the time when people are supposed to be celebrating.
Absolutely, and I'm worried because the team was telling me that it's already after 10 now, it's 10:05. Imagine they are saying after 12 when we do the crossover, it will be worse after that. So the team is going to be busy, extremely busy after that time. So we'll all be alert, and hence we're dispatching the ambulances in specific areas where we know that our allocation is not much. We'll beef up the teams so that they can work together. So our presence today was more motivating them, even in the call center, that everybody must know that we're all here, we'll be working together and ensure that we clear whatever needs to be cleared.
And I mean, at this time, what would be the greatest concern for the health and the EMS personnel?
Our concern again is that the citizens must protect the EMS colleagues, because after 12 they become victims. Now they victimize them when they call them. There are prank calls that I always say the communities must avoid to do, because they are scared of going to specific areas after 12 because they know that they can be marked. So that's our worry now, that people must not fight those that are there to assist them to save their lives.
And also you talk about the fact that EMS themselves do become victims. How do you perhaps fight such a scourge?
We have a team now that we're working very closely with some of the police guys, so that when they go to specific areas, at least the police are aware that they are going there, so that they can follow immediately. But again, there is a panic button now that we have installed to them, so that when they go, they are able to connect immediately with other teams to assist them.
All right. And what can we expect to see today then?
We expect, we wish the number of the calls can be reduced. We need that reduction, but again, the response of our team, we want to make sure that at least we respond on time, so that we assist those, especially these cases like in the medical cases that we have seen that needs urgent attention. We need to save those lives.
And what is your message to the residents that are watching?
My message to the residents that are watching, they must celebrate, but they must make sure that they don't do wrong things when they celebrate. They must not beat each other. They must stop confronting each other unnecessarily, because sometimes you can see that they just create these fights and fight for something that they shouldn't have fight about and end up killing each other. So I want to appeal to them. They must know that this is the time to celebrate, not the time to fight.
Thank you very much for speaking to us. That is the MEC of Health. Of course, she's going to be on the ground with a lot of teams that are going to be working. As you can see, these are some of the vehicles that are going on the ground that are going to be assisting the people. We understand now that the major calls that are coming in and of great concern at this very moment is suicide and assault. We have already heard from the police as well, concern about the rise in assault at this time, saying that a lot of people tend to just continue fighting over things that they shouldn't be fighting over. So great concern there from the MEC, just saying that people must celebrate, but they must celebrate wisely. Over 1,500 calls already, and they are going up, and that's the concern. But at this point, we are going to be on the ground and monitoring those emergency calls and see how people can be helped just before they cross over to 2024.